Medical Assistant Exam Phlebotomy Questions. Question 1. During a primary care office, a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Change the patient's diagnosis to match the meter. Option B. Record patient results without documenting controls. Option C. Use the meter because patient samples are different. Option D. Resolve the quality control problem according to protocol. The correct answer is option D. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Medical assistants do not diagnose and should not alter clinical information to fit a device. Quality control documentation is part of reliable testing. Failed controls must be addressed before reporting patient values. Question 2. For a patient encounter in a same-day appointment, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Use latex-free supplies and clearly communicate the allergy. Option B. Ignore the allergy if the procedure is short. Option C. Use powdered latex gloves because they are easier to put on. Option D. Tell the patient to bring personal gloves only. The correct answer is option A. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. The clinic remains responsible for preparing a safe care environment. Question 3. A medical assistant is working in a diagnostic testing area when a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A. Skip the explanation if the patient nods. Option B. Ask a young child to interpret. Option C. Speak louder and slower in English only. Option D. Use a qualified medical interpreter. The correct answer is option D. Use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Nodding does not prove understanding or valid communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Volume does not remove a language barrier. Question 4. When a patient encounter unfolds in a busy front office, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A. Notify the provider or designated clinical staff promptly. Option B. Tell the patient the exact diagnosis without provider review. Option C. File the result for review at the end of the month. Option D. Discard the result because it is abnormal. The correct answer is option A. Notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Diagnosis and interpretation belong to the provider. Delaying a critical result can put the patient at risk. Abnormal results must be reported, not discarded. Question 5. A medical assistant is working in a certification exam scenario when a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Demand payment details with full medical history. Option B. Leave limited information and a callback number. Option C. Leave another patient's results for comparison. Option D. Describe the diagnosis in detail on the message. The correct answer is option B. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Excessive information violates privacy and may not be necessary. Sharing another patient's information is a privacy breach. Detailed clinical information may be heard by unauthorized people. Question 6. While working in a busy front office, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Use only sterile gloves without a mask. Option B. Skip precautions if the patient is already taking medication. Option C. Apply droplet precautions and offer a mask according to protocol. Option D. Place the patient beside an immunocompromised patient. The correct answer is option C. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Sterile gloves do not protect mucous membranes from respiratory droplets. Treatment does not remove the need for appropriate precautions. Separating symptomatic patients helps reduce transmission risk. Question 7. In a medication administration visit, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Give a diagnosis over the phone. Option B. Schedule the patient for next month. Option C. Follow emergency triage protocol immediately. Option D. Tell the patient to send an email later. The correct answer is option C. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Medical assistants should not diagnose the cause of symptoms. Routine scheduling can delay care for potentially serious symptoms. Potential emergencies require immediate action. Question 8. For a patient encounter in a quality control review, a student asks which blood component helps with clotting. Which answer is correct? Option A. Platelets. Option B. Plasma glucose. Option C. Alveoli. Option D. Neurons. The correct answer is option A. Platelets. Platelets help form clots and support hemostasis. Glucose is a blood sugar and does not form clots. Alveoli are lung structures involved in gas exchange. Neurons transmit nerve signals and are not blood clotting cells. Question 9. While working in a cardiology practice, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Tilt the head far backward. Option B. Sit upright and lean slightly forward. Option C. Pack the nose with contaminated gauze. Option D. Lie flat immediately without assessment. The correct answer is option B. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood, while upright posture can reduce pressure. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 10. After reviewing the situation in a community health clinic, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Discard the tracing to avoid alarming the patient. Option B. Diagnose the rhythm for the patient. Option C. Change the tracing to make it look normal. Option D. Give the tracing to the provider promptly according to protocol. The correct answer is option D. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Abnormal results must not be hidden or discarded. Medical assistants should not provide a cardiac diagnosis. Altering medical records is unethical and unsafe. Question 11. Given the workflow in a certification exam scenario, a reagent bottle is past its expiration date. Which action is appropriate? Option A. Mix it with a new reagent to strengthen it. Option B. Change the expiration date on the label. Option C. Do not use it for patient testing. Option D. Use it only for abnormal patients. The correct answer is option C. Do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Mixing reagents without approval can invalidate testing. Altering dates is unsafe and unethical. Expired reagents are not reliable for any patient testing. Question 12. While working in a preventive care visit, the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A. Appendix. Option B. Kidney. Option C. Spleen. Option D. Gallbladder. The correct answer is option B. Kidney. The kidneys filter blood, regulate fluid balance, and form urine. The appendix is associated with lymphoid tissue in the digestive tract. The spleen filters blood cells and supports immune function but does not form urine. The gallbladder stores bile and does not form urine. Question 13. While working in an administrative check-in area, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Recheck using proper technique and report the finding according to protocol. Option B. Send the patient home to rest without notifying anyone. Option C. Erase the value because it may worry the patient. Option D. Tell the patient that hypertension has been diagnosed. The correct answer is option A. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Question 14. Given the workflow in an internal medicine office, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Use the defibrillator on a conscious patient asking questions. Option B. Begin CPR and use the automated external defibrillator as directed. Option C. Wait for the provider before starting any response. Option D. Give oral medication before checking responsiveness. The correct answer is option B. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. Question 15. At the start of care in a medication administration visit, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A. Leave the fax confirmation on a public counter. Option B. Include unrelated patient charts in the same fax. Option C. Verify the recipient fax number before sending. Option D. Send it to a number from memory without checking. The correct answer is option C. Verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Confirmation pages may contain protected information and should be handled securely. Only necessary information should be disclosed. Memory errors can lead to misdirected protected information. Question 16. A medical assistant is working in a medical office workflow when a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Fowler. Option B. Sims. Option C. Prone. Option D. Supine. The correct answer is option D. Supine. Supine means lying on the back facing upward. Fowler position is seated or semi-seated. Sims position is side-lying with one knee flexed. Prone means lying face down. Question 17. Given the workflow in a patient education session, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Abandonment. Option B. Beneficence. Option C. Patient autonomy. Option D. Respondeat superior. The correct answer is option C. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Question 18. Following office protocol in a certification exam scenario, a pelvic examination is scheduled. Which patient position is commonly used? Option A. Sims. Option B. Trendelenburg. Option C. Lithotomy. Option D. Prone. The correct answer is option C. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position. Question 19. While working in a pediatric clinic, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A. Referral. Option B. Copayment. Option C. Coinsurance. Option D. A remittance address. The correct answer is option C. Coinsurance. Coinsurance is the patient's percentage share of covered costs. A referral is permission or direction to see another provider. A copayment is usually a fixed amount rather than a percentage. A remittance address tells where payments or documents are sent. Question 20. After reviewing the situation in an exam room, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Abandonment. Option B. Assault. Option C. Coinsurance. Option D. Beneficence. The correct answer is option A. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Co-insurance is a payment-sharing insurance term. Beneficence means acting for the patient's good. Question 21. During a telephone triage workflow, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Touch the vein again with an ungloved finger. Option B. Draw blood while alcohol is still wet. Option C. Allow the alcohol to dry completely. Option D. Blow on the site to speed drying. The correct answer is option C. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Palpating after cleaning can contaminate the site unless proper technique is used. Wet alcohol can sting and may affect specimen quality. Blowing can contaminate the cleansed site. Question 22. As part of exam preparation in a diagnostic testing area, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. Patient states, "I have had a cough for 3 days." Option B. The assistant diagnoses pneumonia. Option C. No documentation is needed for symptoms. Option D. Patient is definitely exaggerating the cough. The correct answer is option A. Patient states, "I have had a cough for 3 days." Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Diagnosis belongs to the provider. Symptoms are relevant to the visit and should be documented according to policy. Judgmental wording is inappropriate and not objective. Question 23. Before the visit continues in a clinical skills review, the provider is running behind and a patient asks for an update. Which response is professional? Option A. Guarantee an exact time even when it is unknown. Option B. Tell the patient that waiting is their only option. Option C. Apologize for the delay and provide the best available estimate. Option D. Discuss another patient's emergency as the reason. The correct answer is option C. Apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. False certainty can create more frustration. Dismissive communication is unprofessional. Sharing another patient's situation can violate privacy. Question 24. During an administrative check-in area, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A. Pulmonary artery. Option B. Pulmonary vein. Option C. Aorta. Option D. Superior vena cava. The correct answer is option A. Pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. Pulmonary veins return oxygenated blood from the lungs to the left atrium. The aorta carries oxygenated blood from the left ventricle to the body. The superior vena cava returns venous blood to the right atrium. Question 25. At the start of care in a pediatric clinic, a provider orders a capillary blood glucose test. Which site preparation is important? Option A. Puncture through visible dirt. Option B. Skip patient identification because the test is quick. Option C. Use the first visibly dirty drop for every test. Option D. Clean and dry the puncture site according to protocol. The correct answer is option D. Clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Site contaminants can affect the first drop depending on protocol. Question 26. As part of exam preparation in a diagnostic testing area, coordination of benefits is needed. Which situation does this usually involve? Option A. A patient has more than one insurance plan. Option B. A provider orders a throat swab. Option C. A patient has one cash payment only. Option D. A patient needs a sterile dressing. The correct answer is option A. A patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. A throat swab order does not itself involve multiple insurance plans. One cash payment does not require multiple plan coordination. Dressing supplies do not create coordination of benefits by themselves. Question 27. As part of exam preparation in a clinical skills review, a capillary puncture is needed on an adult finger. Which site is generally preferred? Option A. The little finger near the bone. Option B. The side of the middle or ring finger pad. Option C. The center of the thumb pad. Option D. The tip of the index finger. The correct answer is option B. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The little finger has less tissue over bone and is usually avoided. The thumb is often calloused and has a pulse, making it less preferred. The index finger is commonly used for touch and may be more sensitive or calloused. Question 28. At the start of care in an exam room, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, directly into a vein. Option B, into an area that is bruised and inflamed. Option C, deep into the deltoid muscle only. Option D, abdomen with adequate subcutaneous tissue. The correct answer is option D, abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. Intravenous administration is a different route and is outside a subcutaneous injection. Bruised or inflamed tissue should generally be avoided. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Question 29. In a community health clinic, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, deny the request because there is no job-related need to know. Option B, print the chart and remove the patient's name only. Option C, open the chart if the coworker promises not to tell anyone. Option D, share the chart because staff work in the same clinic. The correct answer is option A, deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. De-identified information must meet specific standards and curiosity is not permitted access. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. Question 30. Following office protocol in a treatment room, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 1 mm per millivolt. Option B, 10 mm per millivolt. Option C, 100 mm per millivolt. Option D, 25 mm per millivolt. The correct answer is option B, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That calibration would make complexes appear too small for standard interpretation. That value would greatly exaggerate waveform size. That value is not the common standard amplitude calibration. Question 31. Following office protocol in a community health clinic, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A, change only the paper on the exam table. Option B, spray disinfectant and wipe it off immediately every time. Option C, open the door to air out the room only. Option D, clean and disinfect touched surfaces according to office protocol. The correct answer is option D, clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. The exam table paper does not address other touched surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Ventilation alone does not remove organisms from contaminated surfaces. Question 32. In a treatment room, a patient makes a complaint about care received in the office. Which response is most professional? Option A, delete documentation related to the complaint. Option B, post the complaint online for staff opinions. Option C, argue until the patient stops complaining. Option D, listen respectfully and follow the office complaint process. The correct answer is option D, listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Destroying or altering records is unethical and may be illegal. Publicly sharing patient concerns can violate confidentiality. Arguing escalates conflict and is unprofessional. Question 33. An office review in a medication administration visit shows that the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A, use the appointment time as the identifier. Option B, stop and resolve the discrepancy before proceeding with care. Option C, continue if the last name matches. Option D, correct the date of birth without asking anyone. The correct answer is option B. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Appointment times are scheduling data and are not approved identifiers. A last name alone does not rule out an identity error. Changing demographic data without verification may create a documentation error. Question 34. In an exam room, the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A, villi. Option B, alveoli. Option C, tendons. Option D, ureters. The correct answer is option B, alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Villi increase absorption in the small intestine. Tendons connect muscle to bone. Ureters carry urine from the kidneys to the bladder. Question 35. While working in an electronic health record review, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask the patient to state 2 identifiers and compare them with the order. Option B. Label the tube after returning to the lab. Option C. Ask a family member to confirm the name only. Option D. Use the room number because it is faster. The correct answer is option A. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A family member may be mistaken and 1 identifier is not enough for positive identification. A room number can change and is not considered a reliable patient identifier. Question 36. An office review in a medication administration visit shows that a subpoena for medical records arrives at the office. Which response is best? Option A. Ignore it because subpoenas never apply to clinics. Option B. Ask the receptionist to summarize the chart from memory. Option C. Immediately fax the entire chart without review. Option D. Give it to the provider or designated privacy officer for proper handling. The correct answer is option D. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Subpoenas can require action and should not be ignored. Summaries from memory are unreliable and not an appropriate legal response. Records should not be released without verifying legal requirements and scope. Question 37. A medical assistant is working in an exam room when the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Sterilization is the same as hand washing. Option B. Packaging instruments makes cleaning unnecessary. Option C. Disinfection always destroys every spore. Option D. Organic material can interfere with sterilization. The correct answer is option D. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Hand washing reduces microbes on skin but is not instrument sterilization. Packaging dirty instruments traps contamination rather than preparing them safely. Disinfection reduces many organisms but does not reliably destroy all spores. Question 38. When a patient encounter unfolds in a women's health clinic, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A. Leave the container unrefrigerated unless it smells unusual. Option B. Collect urine only when symptoms occur. Option C. Keep only the first void and discard the rest. Option D. Discard the first void and collect all urine for the next 24 hours. The correct answer is option D. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Storage requirements should follow the test protocol and preservative instructions. Timed urine testing requires all urine during the collection period. A single first void is not a 24-hour collection. Question 39. During an electronic health record review, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Leave the specimen uncovered at the front desk. Option B. Place the tube in direct sunlight to warm it. Option C. Shake the specimen vigorously for 1 minute. Option D. Wrap the specimen in foil or use an amber container as directed. The correct answer is option D. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Sunlight can degrade light sensitive specimens. Vigorous shaking can hemolyze blood specimens. Question 40. An office review in a women's health clinic shows that a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A, change the results so it appears normal. Option B, diagnose the patient based on abnormal values. Option C, tell the patient the provider will review and explain the results. Option D, post the result publicly so others can comment. The correct answer is option C. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Changing results is unethical and falsifies the record. Diagnosis is outside the medical assistant scope of practice. Public disclosure violates confidentiality and professionalism. Question 41. Given the workflow in a pediatric clinic, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, PRN. Option B, SOAP. Option C, RACE. Option D, NPO. The correct answer is option C, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. PRN means as needed and does not guide emergency fire response. SOAP is a documentation format and does not guide fire response. NPO means nothing by mouth and is unrelated to fire safety. Question 42. At the start of care in an outpatient laboratory, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, ignore the time because tourniquets do not affect tests. Option B, tighten it further until the vein bulges. Option C, move it over the venipuncture site. Option D, release it and allow the arm to recover before continuing. The correct answer is option D, release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. Tourniquet time can affect certain laboratory values. More pressure can increase discomfort and alter specimen quality. A tourniquet is placed above the site, not over the puncture area. Question 43. Before the visit continues in a treatment room, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, reuse sterile gloves from a previous patient. Option B, place sterile gauze on an unclean counter. Option C, reach across the field with unsterile clothing. Option D, open sterile supplies without touching the inner sterile surface. The correct answer is option D, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Sterile gloves are single-use and patient-specific. An unclean surface contaminates sterile supplies. Reaching over the field can contaminate it. Question 44. At the start of care in an exam room, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A, count respirations while the patient is unaware of the measurement. Option B, ask the patient to breathe as deeply as possible. Option C, count for 5 seconds and multiply by 12. Option D, record the respiratory rate from the last visit. The correct answer is option A, count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Deep breathing changes the normal respiratory rate and effort. Very short counts are often inaccurate for respirations. Current respirations must be measured during the encounter. Question 45. The care team in a preventive care visit asks for guidance because the provider mentions the largest artery in the body. Which vessel is being described? Option A, carotid vein. Option B, aorta. Option C, vena cava. Option D, pulmonary vein. The correct answer is option B, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Carotid structures are in the neck, but the carotid artery is not the largest artery. The vena cava is a large vein returning blood to the heart. Pulmonary veins return blood from the lungs to the heart. Question 46. While working in an outpatient laboratory, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A, pancreas. Option B, bladder. Option C, spleen. Option D, gallbladder. The correct answer is option D, gallbladder. The gallbladder stores and concentrates bile made by the liver. The pancreas produces digestive enzymes and hormones but does not store bile. The urinary bladder stores urine, not bile. The spleen is involved in immune and blood cell functions. Question 47. The care team in a phlebotomy station asks for guidance because a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The machine draws blood through the wires. Option B. The electrodes inject medication. Option C. The test shocks every patient to start the heart. Option D. The test records electrical activity and does not deliver a shock. The correct answer is option D. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Question 48. At the start of care in a pediatric clinic, the term nephrology appears in a referral. Which specialty is involved? Option A, bones. Option B, kidneys. Option C, ears. Option D, eyes. The correct answer is option B, kidneys. Nephrology is the specialty focused on kidney function and disease. Orthopedics focuses on the musculoskeletal system. Otolaryngology focuses on ear, nose, and throat conditions. Ophthalmology focuses on eyes. Question 49. To protect safety in an administrative check-in area, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Ignore all provider instructions about inhalers. Option B. Eat a heavy meal immediately before every test. Option C. Wear tight clothing that restricts breathing. Option D. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. The correct answer is option D. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Medication instructions should follow the provider or testing protocol. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Question 50. While working in a cardiology practice, a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A. Stand over the patient with crossed arms. Option B. Sit at eye level and allow silence when appropriate. Option C. Laugh to lighten the mood immediately. Option D. Keep checking messages during the conversation. The correct answer is option B. Sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Closed posture and standing over the patient can seem intimidating. Humor can be inappropriate when a patient is distressed. Distracted behavior suggests the patient is not being heard. Question 51. After reviewing the situation in a diagnostic testing area, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A. Use the oldest card in the file without asking. Option B. Code every visit as preventive care. Option C. Verify insurance eligibility at each visit according to policy. Option D. Skip registration for returning patients forever. The correct answer is option C. Verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Old cards may no longer reflect active coverage. Coding must reflect the service and documentation. Returning patients can have changed insurance or contact information. Question 52. Given the workflow in a community health clinic, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A. Above normal. Option B. Before. Option C. Against. Option D. Below normal or deficient. The correct answer is option D. Below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Above normal is indicated by hyper. Before is indicated by pre. Against is indicated by anti. Question 53. Following office protocol in an infection control audit, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A, probe aggressively until blood returns. Option B, label the empty tube as collected. Option C, gently adjust the needle position while maintaining safety. Option D, remove the tourniquet and continue filling all tubes. The correct answer is option C, gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Excessive probing can injure tissue and increase patient discomfort. A tube without the required specimen must not be labeled as completed. Without blood flow, the collection cannot continue effectively. Question 54. An office review in an outpatient laboratory shows that a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, appropriate marketing. Option B, breach of confidentiality. Option C, quality control testing. Option D, routine scheduling. The correct answer is option B, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Question 55. For a patient encounter in a diagnostic testing area, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A, green heparin tube. Option B, light blue sodium citrate tube. Option C, lavender EDTA tube. Option D, gray fluoride oxalate tube. The correct answer is option B, light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. EDTA tubes are collected later because the additive can contaminate other tubes. Gray tubes are generally collected near the end of the order. Question 56. To protect safety in an exam room, the term hypertension appears in the problem list. Which meaning is correct? Option A, low blood glucose. Option B, joint inflammation. Option C, high blood pressure. Option D is slow breathing. The correct answer is option C, high blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Low blood glucose is hypoglycemia. Joint inflammation is arthritis. Slow breathing is bradypnea. Question 57. Given the workflow in an internal medicine office, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, wave scheduling. Option B, open hours. Option C, clustering. Option D, double booking. The correct answer is option D, double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Question 58. After reviewing the situation in a diagnostic testing area, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A, place the form in the chart without reviewing it. Option B, remove allergies that the patient says happened many years ago. Option C, ask the patient to remember only prescription allergies. Option D, verify the allergy information and enter it clearly in the medical record. The correct answer is option D, verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Past reactions may still be clinically important and should not be deleted without provider direction. Allergies to over-the-counter drugs, foods, or latex may also affect care. Question 59. The care team in a telephone triage workflow asks for guidance because a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, prone position. Option B, Fowler position. Option C, Trendelenburg as the only routine choice. Option D, lithotomy position. The correct answer is option B, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Lithotomy is used for pelvic procedures and does not primarily support breathing. Question 60. As part of exam preparation in a patient education session, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, battery. Option B, coordination of benefits. Option C, defamation. Option D, emancipation. The correct answer is option A, battery. Battery can involve intentional touching or treatment without consent. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Emancipation relates to a minor's legal independence. Question 61. An office review in a clinical skills review shows that a rapid strep test requires a throat swab. Which technique is best? Option A, swab the tonsillar area and posterior pharynx while avoiding the tongue. Option B, touch the tongue repeatedly to collect saliva. Option C, collect sputum from a deep cough. Option D, swab the outside of the lips. The correct answer is option A, swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Saliva and tongue contact can dilute or contaminate the specimen. Sputum is not the specimen used for a rapid strep throat swab. The lips do not provide the specimen needed for strep testing. Question 62. Before the visit continues in a medication administration visit, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, delete sensitive information before the request is reviewed. Option B, follow the office release of information process. Option C, give the record to anyone who asks. Option D, refuse because records belong only to the provider. The correct answer is option B, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Patients have rights to access their health information under applicable rules. Question 63. The care team in a telephone triage workflow asks for guidance because a patient feels faint during a blood draw. Which response should occur first? Option A, stop the procedure and protect the patient from injury. Option B, leave the patient alone to find paperwork. Option C, finish filling the tube before responding. Option D, tell the patient to stand up quickly. The correct answer is option A, stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. A faint patient should not be left unattended. Continuing the draw can worsen the situation and increase injury risk. Standing can worsen faintness and lead to a fall. Question 64. An office review in a primary care office shows that a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A, leave the tube unmixed until pickup. Option B, open the tube and stir with a swab. Option C, shake the tube forcefully. Option D, gently invert the tube the required number of times. The correct answer is option D, gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Failure to mix may cause clotting or poor specimen quality. Opening the tube can contaminate the specimen and expose staph. Forceful shaking can cause hemolysis and inaccurate results. Question 65. When a patient encounter unfolds in an exam room, a specimen label is missing after collection. Which action is best? Option A, follow facility policy for recollection or correction without guessing. Option B, write a name on the tube from memory. Option C, ask another patient if the tube belongs to them. Option D, send the tube with no label and explain later. The correct answer is option A, follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Guessing can cause a serious misidentification error. Patients cannot resolve specimen identity errors reliably. Laboratories commonly reject unlabeled specimens. Question 66. After reviewing the situation in an outpatient laboratory, a chain of custody urine drug screen is collected. Which practice is most important? Option A, use an unlabeled container until the lab receives it. Option B, document each transfer and maintain specimen integrity. Option C, allow the patient to take the specimen home first. Option D, skip signatures if the specimen looks normal. The correct answer is option B. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Unlabeled specimens can be rejected and cannot be reliably traced. Uncontrolled possession breaks specimen integrity. Appearance does not replace custody documentation. Question 67. The care team in a clinical skills review asks for guidance because the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A, place 2 or 3 fingers over the radial artery at the wrist. Option B, place the stethoscope over the abdomen. Option C, use the thumb to feel the pulse. Option D, count respirations before locating the pulse. The correct answer is option A. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The abdomen is not used for a routine radial pulse. The thumb has its own pulse and can interfere with accurate counting. Respirations are measured separately and do not identify the pulse site. Question 68. The care team in a same-day appointment asks for guidance because a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A, tell the patient to search the internet for a diagnosis. Option B, give a diagnosis to save time. Option C, ignore the symptoms because they are subjective. Option D, document the symptoms and tell the patient the provider will evaluate them. The correct answer is option D. Document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Unguided self-diagnosis can be inaccurate and unsafe. Diagnosing is outside the medical assistant scope. Reported symptoms are relevant and should be documented. Question 69. Before the visit continues in a community health clinic, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A, keep the screen facing the waiting room. Option B, share passwords with trusted co-workers. Option C, disable audit trails to speed workflow. Option D, lock the workstation before stepping away. The correct answer is option D. Lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Visible screens increase privacy risk. Shared passwords weaken accountability and violate security practices. Audit trails support security monitoring and should not be disabled by staff. Question 70. The care team in a medication administration visit asks for guidance because a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, activate emergency response and assess breathing according to training. Option B, finish documenting the previous visit. Option C, move the patient to a chair before assessing. Option D, offer water by mouth immediately. The correct answer is option A. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Giving oral fluids to an unresponsive patient risks aspiration. Question 71. Following office protocol in a community health clinic, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, gray fluoride tube for all serum tests. Option B, lavender EDTA tube for serum. Option C, light blue citrate tube for serum. Option D, a red or gold serum tube. The correct answer is option D, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. Gray tubes are not the standard serum tube for routine chemistry panels. EDTA prevents clotting and produces whole blood or plasma, not serum. Citrate anticoagulant is used for coagulation testing. Question 72. As part of exam preparation in an outpatient laboratory, the term tachypnea appears on an intake form. Which meaning is correct? Option A, low temperature. Option B, painful urination. Option C, rapid breathing. Option D, slow pulse. The correct answer is option C, rapid breathing. Tachy means fast, and near relates to breathing. Low temperature is hypothermia. Painful urination is dysuria. Slow pulse is bradycardia. Question 73. A medical assistant is working in an urgent care office when soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A, gloves completely replace hand hygiene. Option B, alcohol sanitizer is always illegal in clinics. Option C, hand washing is needed only before eating. Option D, soap and water help remove spores more effectively from the hands. The correct answer is option D. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Gloves reduce exposure but do not replace hand hygiene after removal. Alcohol-based hand rubs are appropriate for many routine situations. Hand hygiene is required at multiple points in patient care. Question 74. Before the visit continues in a patient education session, a complete blood count is ordered. Which tube is most commonly used? Option A, red tube with no anticoagulant. Option B, gray tube with fluoride oxalate. Option C, lavender tube with EDTA. Option D, light blue tube with sodium citrate. The correct answer is option C, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. A red tube allows clotting and is not the standard choice for a complete blood count. Gray tubes are used for tests such as glucose or lactate depending on protocol. Sodium citrate is used mainly for coagulation studies. Question 75. Before the visit continues in an internal medicine office, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, painful or difficult urination. Option B, excessive thirst. Option C, difficulty swallowing. Option D, ear inflammation. The correct answer is option A, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Ear inflammation is otitis. Question 76. As part of exam preparation in a pediatric clinic, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, cover it with loose papers. Option B, wait until a patient reports slipping. Option C, place a warning sign and arrange cleanup immediately. Option D, ignore it because it is not in an exam room. The correct answer is option C, place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Loose paper can worsen slipping and does not clean the hazard. Prevention should occur before an injury happens. Safety hazards matter throughout the facility. Question 77. In an outpatient laboratory, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A, refuse all care without considering exceptions. Option B, assume all minors can consent to every service. Option C, follow state law and office policy for consent requirements. Option D, ask another patient in the waiting room to consent. The correct answer is option C, follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Some laws allow minors to consent for certain services. Minor consent is not universal for all services. Other patients cannot provide consent for the minor. Question 78. Given the workflow in an electronic health record review, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PERLA. Option B, ARICE. Option C, HIPAA. Option D, PASS. The correct answer is option D, PASS. PASS stands for pull, aim, squeeze, and sweep. PERLA describes pupil assessment. RICE refers to rest, ice, compression, and elevation for certain injuries. HIPAA governs health information privacy and security. Question 79. As part of exam preparation in an exam room, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A, complete all paperwork before telling anyone. Option B, ask the patient to drive to another clinic. Option C, tell the patient it is probably anxiety. Option D. Notify the provider immediately and follow emergency protocol. The correct answer is option D. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Administrative tasks should not delay reporting possible cardiac symptoms. Potential cardiac symptoms should be handled through established emergency procedures. Medical assistants should not diagnose the cause of chest pressure. Question 80. An office review in an administrative check-in area shows that the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Store it in a desk drawer overnight. Option B. Place it in direct sunlight to warm quickly. Option C. Use it after expiration if it looks clear. Option D. Maintain required temperature storage and check expiration before use. The correct answer is option D. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Room temperature storage can damage refrigerated products. Sunlight and heat can damage the product. Appearance does not prove potency after expiration. Question 81. Before the visit continues in a cardiology practice, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A. Lavender tube. Option B. Gray tube. Option C. Light blue tube. Option D. Green tube. The correct answer is option D. Green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Lavender EDTA is typically used for hematology testing. Gray tubes are often used for glucose-related testing depending on protocol. Light blue citrate is used for coagulation testing. Question 82. As part of exam preparation in an electronic health record review, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Follow manufacturer instructions and quality control policy. Option B. Skip controls because waived means unregulated. Option C. Use expired kits if the package is unopened. Option D. Report results before the test develops. The correct answer is option A. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Expired test kits may give unreliable results. Reading before the correct time can produce inaccurate results. Question 83. When a patient encounter unfolds in a treatment room, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A. Copayment. Option B. Premium. Option C. Adjustment. Option D. Deductible. The correct answer is option A. Copayment. A copayment is a fixed amount the patient pays for a covered service. A premium is the amount paid to maintain insurance coverage. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 84. The care team in a medical office workflow asks for guidance because the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A. Inflammation. Option B. Abnormal softening. Option C. Surgical removal. Option D. Visual examination. The correct answer is option C. Surgical removal. Ectomy means surgical removal of a structure. Inflammation is indicated by itis. Abnormal softening is indicated by malacia. Visual examination is often indicated by scopy. Question 85. While working in an electronic health record review, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A. Urinary bladder. Option B. Appendix. Option C. Thyroid gland. Option D. Gallbladder. The correct answer is option C. Thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. Question 86. At the start of care in a same-day appointment, a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A. Blood culture bottle. Option B. Gray tube. Option C. Lavender tube. Option D. Light blue tube. The correct answer is option B, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Blood culture bottles are used to detect bloodstream microorganisms. Lavender EDTA is used mainly for hematology testing. Light blue citrate is used for coagulation studies. Question 87. Following office protocol in a women's health clinic, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, place the probe over wet nail polish. Option B, ignore the waveform and record the lowest value. Option C, increase oxygen without reporting the finding. Option D, warm the finger or choose a better perfused site. The correct answer is option D, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Moisture and polish can interfere with sensor performance. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Question 88. After reviewing the situation in an electronic health record review, a centrifuge is used in the laboratory. Which safety practice is important? Option A, balance tubes before starting the centrifuge. Option B, place only one tube at any weight in the rotor. Option C, stop the rotor with a hand. Option D, open the lid while it is spinning. The correct answer is option A, balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Unbalanced loads can damage the machine or specimens. Stopping a rotor manually is dangerous. Opening a spinning centrifuge is unsafe. Question 89. While working in an outpatient laboratory, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A, explanation of benefits. Option B, sterilization log. Option C, advance directive. Option D, progress note. The correct answer is option A, explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. A sterilization log tracks instrument processing, not claim payment. An advance directive communicates future care wishes, not payment information. A progress note documents clinical care, not insurance payment decisions. Question 90. The care team in a primary care office asks for guidance because a provider documents a vaccine administration. Which coding information may be needed for billing? Option A, procedure code and diagnosis or reason for the service. Option B, only the room number. Option C, only the assistant's initials with no service information. Option D, only the patient's favorite color. The correct answer is option A, procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Room numbers do not describe the service or diagnosis. Initials alone do not provide billing codes or medical necessity. Personal preferences do not support claim coding. Question 91. While working in a treatment room, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, clean catch midstream specimen. Option B, a random sample from an old urinal. Option C, specimen collected from the toilet bowl. Option D, first drops of urine into an unclean container. The correct answer is option A, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Old specimens may be contaminated and may not reflect current results. Toilet water contaminates the specimen. Initial urine can carry contaminants and an unclean container is inappropriate. Question 92. As part of exam preparation in a preventive care visit, a prothrombin time test is ordered. Which tube should be selected? Option A, blood culture bottle only. Option B, gray tube. Option C, light blue tube. Option D, lavender tube. The correct answer is option C, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Blood cultures detect microorganisms and are not used for prothrombin time testing. Gray fluoride oxalate is not the standard additive for coagulation studies. Lavender EDTA is used for hematology and can interfere with coagulation testing. Question 93. Given the workflow in an urgent care office, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, reaching across the sterile field with an unsterile sleeve. Option B, keeping sterile items above waist level. Option C, opening the wrapper away from the body first. Option D, using sterile forceps for sterile supplies. The correct answer is option A, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Sterile forceps can help maintain asepsis when used correctly. Question 94. For a patient encounter in a women's health clinic, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, delete all pharmacy information from the record. Option B, choose the pharmacy closest to the clinic. Option C, leave the old pharmacy because it is already in the chart. Option D, update the preferred pharmacy after verifying the new information. The correct answer is option D, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Removing needed information can interrupt prescribing workflows. The preferred pharmacy should come from the patient rather than staff convenience. Outdated demographic information can delay medication access. Question 95. A medical assistant is working in a specialty referral visit when the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A, skip explanations because the patient signed in. Option B, leave the patient uncovered until the provider arrives. Option C, discuss the patient's body in the hallway. Option D, provide appropriate draping and expose only the area being examined. The correct answer is option D, provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Patients still need respectful communication during preparation. Unnecessary exposure reduces dignity and comfort. Public discussion can violate privacy and professionalism. Question 96. Before the visit continues in a clinical skills review, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, another patient's insurance card. Option B, only the patient's favorite pharmacy color. Option C, the assistant's diagnosis before the visit. Option D, demographics, contact information, insurance information, and reason for visit. The correct answer is option D, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. Insurance information must belong to the patient being registered. That information does not complete registration. The assistant should not diagnose during scheduling. Question 97. Given the workflow in a telephone triage workflow, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A, the blood pressure may read falsely high. Option B, the blood pressure may read falsely low. Option C, the temperature will be elevated. Option D, the pulse oximetry reading will be inaccurate. The correct answer is option A, the blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. A cuff that is too large is more likely to produce a falsely low reading. Cuff size has no direct effect on body temperature. Cuff size does not directly determine oxygen saturation accuracy. Question 98. During a diagnostic testing area, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A, lock the wheelchair and use proper body mechanics with assistance as needed. Option B, ask the patient to jump to the table. Option C, leave the wheelchair unlocked for easier movement. Option D, pull the patient by the arms quickly. The correct answer is option A, lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Question 99. For a patient encounter in an internal medicine office, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, Avoid documenting that instructions were given. Option B. Review the provider-approved instructions and confirm understanding. Option C. Tell the patient not to call if symptoms worsen. Option D. Create new instructions that contradict the provider. The correct answer is option B. Review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Patient education should be documented according to policy. Patients should know when and how to seek help for concerning symptoms. Instructions should match the provider's plan and office protocol. Question 100. At the start of care in a busy front office, the term otitis media is listed in the assessment. Which body area is involved? Option A. Middle ear. Option B. Liver. Option C. Stomach. Option D. Kidney. The correct answer is option A. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Liver inflammation is hepatitis. Stomach inflammation is gastritis. Kidney inflammation is related to nephritis or pyelonephritis.